so much for having me. I'm very excited to be here. I live locally and it's exciting to, to hang out here with you guys. So I'm going to teach you guys something that's very strength-based. I learned this more pathologically based of when ruptures of bonds rupture, and then what happens and what it looks like when there's a rupture. And along the way, while I was, treating couples or training and doing my own learning, I realized we don't quite know what a good secure bond looks like. So one day I was just daydreaming and this kind of came to me, and I'm so proud of it. It's really, really simple. I call it 4 easy steps to secure bonds, but it's actually a lie because there are sub-steps and then one more step, so it's more like 6.1 easy steps to secure bonds. And just because I'm like a huge nerd, I take after someone that's in the family, nerd. You may notice if you're into physics or anything like that, 6 Easy Pieces, Richard Feynman, just a shout out to him. He grew up in this neighborhood, Nobel Prize laureate. So he grew up in Far Rockaway. If you ever drive by Carnegie Avenue, you may notice. So just want to say we're on sacred academic grounds here in Far Rockaway, New York. So let's go. All right, so this is the cool part about attachment needs. It's lifelong. So we can easily and ethically take a human specimen and see how it's supposed to work according to nature. A baby is born super needy. They don't even need to know what their needs are to get their needs met. They have the need by default, by design. They're born. What do they do naturally? Cry, right. For adults, I changed it to call, but for babies, it's a cry, and it's automatic. If they're healthy, the second they're born, they're like, ah! So this should be a reflex. I have a need, I cry out for some social help. The baby has physical needs at first, but then as we grow and evolve, we have some other needs because we're mammals. So we are definitely like a pack type of group. We cannot survive or function on our own independently, much as I try to be. I can't. I need to lean on my brother when I need help. I need to lean on my close loved ones, my family, if something's wrong. I can't fully take care of myself. I need to lean on the farmers for food because I can't fully do everything. So we're all so interconnected and interdependent. So not only do we have the need and we need to call or cry, but this needs to be clear. We need to be confident and comfortable being able to do so. And this oftentimes gets blocked, which I'll get into soon. So that call, let's go back to this baby. Now the baby's out of the delivery room, at home, empty belly, hungry, cries. This cry needs to reach someone, right? So it goes from intrapsychic within that baby of I have a need, I'm gonna cry, to interpersonal. Now this call needs to go and reach somebody, reach a caregiver. Oh yeah, there are handouts, I'm sorry, if you want to pass them around and to the doctors back there. Yay, so proud of you. Sorry, our nephew-in-law just got into med school. Yes. So, congratulations on your big journey. Okay, so we go from intrapsychic, which is within the person. I have a need, I call, I cry out, to interpersonal. What happens? That cry needs to do what? What does that cry reverberate towards? Where is that cry for the baby supposed to land? Parent, caregiver, somebody. Their ears need to hear it. And if they are in tune and good, they're gonna turn. That's the next step. So what happens? They turn away from everything else and everyone else, and they turn towards the caller or the crier. So that looks, actually I did this step a little too soon. It's more like, huh? What? Baby's up? Baby's crying? Like that. It's just a noticing. They hear it. And then usually, you saw how I did that in one swoop, right? Usually there's a response, there's movement. So now this caregiver is going to come, and what are they going to do, hopefully? Respond. What would that look like? Pick up that baby, right? So there's movement to it. So this is all like really good and smooth and clear. They fill up a bottle or take the baby to breast. And now again, it goes, this is more that reflex of like, baby's crying, move, that's intrapsychic, and then interpersonal. Now I need to feed that baby. I'm going to now try to feed that baby. What does the baby need to do in order to get their need met though? Stop crying, open their mouth, and take in the food. This is something that we often think is like, oh, it's a normal step, but this is actually the hidden step. The response needs to go and fill that need, and the one who needs and calls needs to let it in. And when that happens, this is no longer broken arrows, this is a bond. This is a bond. Until 4 minutes later when another need arises and we have to do this again. But this is basically a pattern of getting needs that are natural, called out, being heard, being responded to, being let in, and then soothing. Again and again and again and again. And this is beautiful. And this, we talked about parent-child. So this dotted line would actually be a solid line. The parent would always be on the bottom, and the baby, the needer, the caller, the crier would always be on top. We don't lean on the baby to take care of the caregiver's needs until way later down when we're a bit old and decrepit and we're wearing our diapers and we need our babies to change. Can't wait. So that's that line. But then in like friendships, peer groups, adult attachment, romantic relationships, we have this dotted line. And if you really look at every single interaction, you're going to notice that if we're doing it well, there's one person in need and one person responding. We don't do it both at once because then the bond can't actually gel or be built. So what happens when this goes wrong? What happens when this goes wrong? And when I say wrong, look how many spots it could go wrong. It could go wrong over here. I don't have needs. Now, how does an adult think that they don't have needs? Usually from years of neglected childhood. We see in Mary Ainsworth's Stranger experiment. You know about it? You're nodding. Anyone else know about it? No? Okay. So Bowen was the first guy, sorry, I speak very colloquially, not so academic. Bowen was the first guy to understand the idea of attachment. He wanted to call it love, but he was British and he didn't want to be mocked, so they're like attachment. So he noticed it with babies and children and stuff. He didn't pay attention to adults. Now in this day and age, we've evolved and seen that this actually holds in our bodies from cradle to grave. Mary Ainsworth was a student of Bowen's, and she wanted to really, really test this stuff to see attachment styles and how it works out. So she set up a situation where she had a baby and its caregiver come into a room. There was like toys and different things. It was a strange new environment. And the baby is being held and put down, and then very soon after the parent leaves the room, they observe the baby, and then the baby returns and they observe the reunion. I'm sure I'm getting details wrong. No? It's okay? Okay. So he's my older brother. I clearly look like, am I getting it right, Dr. Stafford?
Did I turn toward your call appropriately?
Yes, thank you. I feel very soothed. So what happened? So they saw certain types of babies, based on how they were parented, responded differently to this. Here's what secure attachment looks like. Again, I like strength-based, so let's give you the secure attached first. Baby is being held, baby is being put down, looks towards caregiver, looks towards toys, slowly goes, explores, likes, comes back, touches base a little bit, goes back to toys, parent leaves, baby bawls, can't function. Parent comes back, baby crawls over or toddles over, gets hugged, gets soothed. The beautiful attuned nervous systems, everyone's regulated. That's secure. That's secure. That's when this kept happening for that baby's first year of life. Unfortunately, there's another type of attachment style for parenting. The baby gets put in, doesn't quite look at the caregiver to explore, kind of goes and explores, and also not as much as the first baby. The caregiver leaves the room. the baby then notices and goes, ah. No bawling. Little 1-year-old kind of sits quietly, and the caregiver comes back. The baby like doesn't quite need that soothing and doesn't really do much, and like doesn't want the soothing either. So that type of parenting is how an adult ends up. Why was that baby different than the first secure bond? Because in that first year of life, that baby's needs were not getting met. So how smart of our resources, like, should I keep calling out just for no one to meet my needs? Or can I do something? Can I evolve a little bit? Squash the need, squash the need, squash the need. So you're not gonna even hear the cry. You're not even gonna hear the cry. So as adults, what does this look like? Can someone, I like participation, I like collaboration. So if you're comfortable, can someone think of like an adult who maybe is like that baby and what they would say in a given situation? A sort of situation where it seems like I don't even have a need.
Someone who's like hyper independent, they pretty much think they can handle everything on their own and don't need help.
That's right, exactly. And it's a beautiful thing when they can, but it doesn't mean that they actually don't have needs. So when they have that need, and they're like, if they were in a secure space, they would need someone else, what would they say or do in that moment when they're struggling, but they don't even admit that they're struggling? What would that look like? Or what would they say? Or anyone else, I don't mean to put you on the spot.
You say, I'll figure it out myself.
I'll figure it out myself. Exactly. That's the avoidant. That's the avoidant attachment style. And that's based on neglect. That's based on needs not being met. So the block would be over here. So the therapist would then kind of need to notice that this human being needs permission to have needs and needs to see it through. That not only are you allowed to have a need, but if you try this out, someone is going to show up for you. Oftentimes in family therapy, the family system that they're in will not show up for them for various reasons. Partly because they constructed it that way by design. They were with people who wouldn't bug them to keep trying to take care of their needs. And also over time, the system, even if they would want to be there for the needs, they kind of learned not to. Because of various things. So who is going to be the one who's the turner and responder for the avoidant? In my settings, it's actually the therapist. The therapist is going to be highly attuned, trying really hard to like elicit some need and give some responsiveness. So first of all, any questions on that? No, okay, good. Okay, that's one place it could be blocked. Another place is, let's say, I know I have needs, but I don't think this call is gonna work. So I'll just kind of rush ahead, forget the babies and stuff like that. In adult relationships, if I'm with a partner who I don't think my call is gonna move past my call, what am I gonna do? And this is open-ended, so many options. Look for another option. So perhaps I'm gonna outsource my needs. Perhaps it's gonna be in like an acceptable way. Lots of friends, lots of like close other relationships. Perhaps it's gonna be more of an infidelity situation. Perhaps it might even be an addiction. That is nice, because that's a little more available to me than, let's say, a human being. So the call is still being called, but not down, not towards the other partner. It gets called out. And then someone responds to it, or something, some substance, something. So that's that. So what is that? Let me hear, you did a great job with giving me like what it sounds like for someone who doesn't have needs. I could take care of it myself. Let me hear, what would an adult who calls elsewhere, what's a sentence I would hear them say about maybe this relationship or something?
Nobody cares about me.
Yeah, exactly. You got it? You're gonna say.
Yeah, I was gonna say this.
Exactly,
You never-
exactly.
I was gonna say, as long as you never do ABC.
Right, exactly. I like that we're corroborating. That means we're on the right track. We're doing this for real. This is great. Good. I forgot there's another kind of call. Let's say I'm not that type to like go outside and my call won't work. I know if I'm vulnerable and I'm like, do you love me? It's not gonna work. Or like, hey babe, whatever, not gonna work. So instead, I wanna aim my call towards my partner. I wanna stay in the relationship. Could anyone guess what I'm gonna start to sound like? I'll give you an example. Why is the garbage not taken out? Again? Okay, how many times do I have to ask you? So look at me, I'm using my voice. I'm like, I know I have a need. I need you to do something with me. I may actually be a little fuzzy on what that need is, but I am gonna call. I'm gonna be crying. And as a therapist, I could feel the difference in my body sitting with people who are calling like straight from their need and calling what I call like a drunk call or like a fuzzy call, something like that. I'm gonna pick your brain after to find out what you would call it because you're so articulate. I know I'm glazing you. So I could feel it in my body. It feels like a call that cannot be met. And it feels like for the partner, nag. And that poor partner, what are they gonna do? They're gonna respond to the words, to the content. Okay, I'll take out the garbage. I'll take it out. Okay, it's out. Is that better? No, it's not better. Okay, I can't soothe this person. It feels like this person can't be soothed. But really what it is the call is not clear. The call is not clear because for some reason the caller doesn't believe that the real call will be heard, or maybe they don't know they're deserving of being responded to, whatever it is. Okay, good. Any questions on this part? Great. So we're gonna move forward. What's the next step? Turn. So it has the double turn. The turn, I also want to just point out, turn over here is very much, if I do this well, I'm saying, I hear you. I hear your call. And this response is going to tell the partner, I am here for you. So there's a big difference between the two. So some people are blocked from turning towards, like they can't turn away from everything else. They can't turn towards the caller. So I have a dear friend who is so generous and such a good responder. She's there every time I need something, and other friends have also said, oh my gosh, this friend is here 24/7. She'll talk to me for an hour when I need her. So she's really, really good at responding to me. And she's also confided in me that when her family calls for her, for some reason, it doesn't activate the same system. So I could be at her house and her husband or her kids or something like that could be like putting out some call. Nothing, if it's crazy, she'll ignore me. But she kind of doesn't like turning away from everything else she's shared with me. Like I kind of would rather not. So for some reason, whatever reason, and it's our job as therapists to get curious and find out what is the reason, why, people sometimes are blocked in turning towards this. Some people are blocked in turning towards anything. Why would someone be blocked in turning towards anything? Why would someone not realize like, oh, this person's crying out for me? Like what do you think? What's like something going on inside? What might be blocking someone over here? And there's no right or wrong answer. It could be anything. Just put yourself in these shoes. I don't want to hear that so-and-so is crying out for me, because then what? Anyone?
Maybe they have like their own issues that they're dealing with in life.
Yeah.
I feel like theirs is more coming from
Right. They may be hearing their own cry so loud. They may be hearing their own like, I have only so many resources and I'm dealing with this right now and I need to block out that. So it could be that. Healthy wise, it would be great if someone can turn to signal, hey, I'm just letting you know I care about you. I would be here for you, except that I can't right now. I can't even hear you right now because I'm so busy with this. So there's nothing wrong with not being able to flow as long as we're reporting it. So yeah, that's a great thing. Like, hey, just dealing with a death in the family right now, so I'm sorry I can't, whatever. So that's very good. That actually is very good and healthy. Hold on a second. Yes, so what you said, like maybe I have too much going on. This keeps us from turning away from everything else and turning towards the caller. Why would I sometimes be like ready to turn towards anyone but not this particular person? You ever see someone like this? Like, I give up on this one. Everything I do, like I've tried to help, it doesn't go anywhere. So we might be blocked over here. I'm not gonna turn towards the caller. I don't believe that it's gonna work. So I'm gonna eventually drown it out. Okay, but if it's secure, then I go from, oh, someone's calling me that I care about, I'm coming, that's response. So responsiveness is very different than turning towards. If let's say someone says, do you love me? If I'm good at turning, I'm gonna say, oh, you wanna know if I love you? You really wanna know? Oh, it's so hard for you not to know if I love you. Do I love you or not? Like, the responsiveness has movement to it. It has something that actively, like, it's also not just, yes, I love you. It's, of course I love you. There's a responsiveness there. Because when someone says, do you love me? It's not just cut and dry, do you love me, fact, true, untrue. It's also like, I'm insecure. So the response.
You were saying in terms of a reason someone might not turn toward the caller, just to back up a little, is because there's this sense of futility or.
Yeah.
Can it also be where it's not futile, it's just so much of it, it's like I'm burnt out, or actually what you were saying about do you love me reminded me, a few years ago I heard a patient on the payphone on the inpatient unit saying, tell me you love me. Okay. Tell me you love me. Tell me you love me. F you, I don't believe you.
Exactly. Exactly. So let's plug that in, right? Definitely knows his need. It was in him or her?
Him.
Definitely knows his need. Kind of knows how to call out, right? I don't know, even if the turner and responder did, F you, I don't believe you. So that person is blocked over here. I'm not going to let that soothing in. That's disorganized, by the way. If anyone knows about disorganized attachment, borderline personality disorder, they're blocked right here, like really blocked. Even if we get them to call properly, they're blocked right here, which is so tragic. So tragic. Okay, so the turning away. Tell me what you said again about the
other reasons that it might not be
futility,
so you're
putting
but just
yourself
like
in the
just like either burnout, like this person, the sense perceiving the other person as so needy, or the sense of kind of the one, like, well, you haven't fulfilled my needs enough, I need a turn.
Exactly. Thank you. Okay, so if giving the inpatient example of do you love me, we can only imagine the person on the other end. Barely even turning, and certainly if they respond, it's not going to have movement. And then the burnt out part, or like I have so much going on myself, that speaks to the fact that we're not taking turns. There's like two needers right here, which is why in therapy I love slowing it down and being like, it's not going to feel so fair, but right now, who are we gonna focus on as the giver and the receiver? And it has to be even overall, but in micro moments, it's not going to be. So very good. Okay, so any other things on turn?
Maybe someone doesn't know how to respond because they never learned that, or they never responded to properly themselves.
Thank you. This speaks to like intergenerational trauma sort of patterns, right? Like, let's say my heart is here, I would love to, but I was never quite responded to myself, so I might be blocked. I really might be blocked. And there's little good news here that we see not so much in attachment, like peer-to-peer, but parent-child. Usually a parent could surpass the attachment quality that they were given as a child. Usually, like, something is a bit hardwired in. usually. And if not, and it's to a point, they get blocked. They need to, get a little love over there, a little attention, however that looks like to learn. But yes, let's say peer to peer, it's complicated. It's damn complicated. And so I might want to, but I may not know how. So let's even take that and then fold it in. How would healthy look like if I'm blocked for reasons having nothing to do with this bond? What kind of conversation could you imagine? You and the room, what kind of conversation could you imagine happening that feels growth-oriented, health-oriented, securely bonded about the fact that I don't effing know how to respond to you?
Literally just say that, like, I wanna help, but I don't know what to do, so how can I help you?
Good. Beautiful. Beautiful. This kind of language really keeps us back on track because we're only human. We're going to be, I don't know anyone who has this all the time or even majority of the time. Well, maybe some people, but we're gonna be derailed. So having this tool of just self-expression and showing intent, like I want to be there for you, I just don't know how, and leaving it open, showing our own vulnerability, which is huge what you're bringing in. The key to keeping this going is vulnerability. There's something so vulnerable about being needy. There's something so vulnerable about taking that leap and leaning in on our partner or whatever it is. So vulnerability is what gets us out of the tangles. So that's very good that you brought that up, thank you. Okay, so with response, we might be blocked because we just were never taught, we don't know how, we want to know, there's an easy way out, we can learn, we can ask them, what do you need from me? Hopefully they do know their needs. Or it may be like what Dr. Statman overheard, like, I know not to respond to this because it's not gonna get soothed. So let's just talk about this piece of that, the more pathological piece of like, everything is going right, but I can't let in the soothing. Let's just feel that out a little bit. That's that borderline personality disorder. That is that, disorganized attachment, or they call it fearful avoidant attachment. Do you guys have any cases like that? That's where things get really sticky. Any, like, even not the patient, but the family member or anything like that with that, or no?
I'm not sure if this applies. We have a case now. There's an 80-year-old man who came in after a second suicide attempt because he reports his wife is a hoarder, and there's a desk in the bedroom piled high with all sorts of stuff, and if only she would clean it up, he wouldn't have to do that. But when he sees it, it brings this black cloud, and he's calling her now from the hospital, telling her, like, I need you to do this, and she's like, okay, I will, but he's not confident that she will. She's been, he says you can't teach an old dog new tricks, although that's not true.
Right.
So he's kind of, I don't know where this all maps out, but there's a need that he's expressing, might not be appropriate, or he's pinning his whole well-being and
Right.
even his life itself on her behavior.
On the desk.
Yeah.
Yeah. Good. Guys, plug this in. So where is he here? First of all, is he blocked anywhere? Or is he A-okay?
Does he really know what his need is?
There it is. There it is. Yeah, there it is. Right. So let's now play it out. He's reporting probably not the right, like, we can't speak for him, it's presumptuous, but I'll be presumptuous. I don't think he's reporting the actual need that I need to kill myself because this desk is piled up. So this need doesn't seem like a proper need. His call is so clear. Based on his off need, he's calling so clearly, he's reporting.
So actually, he said, now this admission to the hospital, he called his wife yesterday, he said, I've never been this direct with her in the past.
Oh, that's good.
He usually would sort of just like have his own sense of futility, or she in the past would, he said this morning, she would joke and in like almost a cruel way, like, oh, I'll wake up in the morning, oh, I'm gonna clean up the desk today, haha, no I won't.
Yeah.
And so he never really put out the call as much until now. He's kind of more explicit about what he believes he needs.
Good. So I definitely commend his bravery. That's not easy to, say your call, or to say your need, but probably it's not the right need. He's calling out directly for the first time. Let's say she turns away from everything else. She's like, forget my mahjong, I'm gonna clean that desk. And she totally turns towards his need that he reports. She does it. Do you think it'll soothe him? Do you think he's gonna want to live this glorious life of his
The clear days.
clean desk, beautiful day? No. So he's gonna appear like that would appear to be borderline in a way, like he's not getting soothed if she does it right. And what do you think that does to the wife after all these suicide attempts and she finally gives him a key to wanting to live and it doesn't actually work? What do you think that does to her? Let's put ourselves in her shoes a little bit. In terms of like,
She'll be less likely to respond to his needs in the future. Because
exactly.
she knows that she won't get the proper response, I guess.
Exactly. She can't quite trust it. Like she was now behaviorally trained that this isn't gonna work. She did not get reinforced properly because his need was not accurate, even though she tried. So she's learning, I'm not gonna actually listen so much. So that will make her erode over here. She's gonna kind of turn less.
So the thing is, he told me yesterday that his daughter has actually cleaned sometimes, right? So I think it's also like, because it's not the right need, even if it's continuously being met,
Right.
there's like, they might keep cleaning it for him, but it's still not gonna help him.
Right.
And so they're still trying to help him, but it's not helping.
It's not gonna help him.
He
Exactly.
he told me that his daughter comes and cleans, and I asked him, when his daughter comes and cleans, does that make him happy? And he says, no, because it should be his wife who cleans, and she should be able to do this. And so for context, his wife has dementia, he has Parkinson's, and so they're both sort of losing functionality. So this desk is like kind of a representation of their overall decline and maybe inability to properly manage the place over time. And he has some resistance to the idea that she has dementia and there might be some overall decline. So it's really like stemming from like this need that's not will be continuing regardless of whether the desk gets cleaned or not.
So his actual need is probably hope that his dementia goes away, and I think that if she actually cleans it, it will give him like some hope that maybe something
That
will
she's
change.
not
But he
as
doesn't
sick,
realize
yeah.
that it's not gonna work.
Right. This conversation is so important that you are all having because you're outside of the system. He's in it, she's in it, the daughter's in it, they're going around this thing and it's not working out. And you guys are looking at it, you're saying, okay, the need is clearly not the need, but it's obviously a vital need because he's willing to risk his life for it. What is this real need? And then if we were to find it, do we want to just like splat it out there for him? Like, hey, you want to kill yourself because your life sucks and you have Parkinson's, your wife has dementia? No. So how do we gently make a bridge between his reported need and maybe what's going on here? So first of all, the first thing we do is we kind of dance with him, right? And I'm sure you guys are really good at this, just a lot of reflection, a lot of understanding, a lot of, yeah, okay, I get that, right? And then once we're dancing his rhythm, what else, and let's all try, because really this is the beauty of therapy, it's more of an art than a science. So let me see your painting of what you would say to like bring him to a space that's not so dangerous, but also not exactly what he's reporting. What comes up? What would we say, maybe?
I mean, maybe they can do it together. I mean, I don't know. It's something, an activity they can do together. Maybe work on the house.
Yes.
Maybe not just the desk. They can.
Right. So that's great for giving him a little like power over his reported need, which is like the desk, the house, the cleanliness, and that will be good. And maybe that's all we could do, right? Because we can't stop the dementia, we can't stop the Parkinson's. If we want to bring his level of awareness to the illness and to the overall decline of this couple, how would we gently just like open up a little shift there?
Well, I tried to broach the subject with him this morning. I said, sometimes when people have dementia, it can manifest as behavioral changes. and in that circumstances change, it could be useful to get some help, and there's nothing wrong with that. I do feel like there is some hyper independence on his end, not
Right.
only on his own behalf, but
Right.
at them as a relationship. He doesn't
Right.
want to seek out help from his daughter, who is in charge of a big company in Manhattan and is very busy. He doesn't want to put a strain on her, so.
Yeah, good. So you're bringing up this space of like he's kind of blocked from getting the help that he needs. If they're declining, then he's so trapped, which makes me feel like if I were in his shoes, it's great to exit through suicide. Hate to say it that way, but if I can't even get help and this isn't changing, then like of course he keeps going to the exit of like I can't live. Not that we should support that or anything like that. I'm just putting myself in his shoes and I'm like, actually in my mind suicide kind of makes sense over here. So first of all, I would definitely reflect that need for suicide, because in a way, if I reflect it, I'm going to join him there, but I'm also going to maybe introduce some other pieces that he's kind of resistant to, which I would also be resistant to, of like, whoa, your wife isn't what she used to be. Like that desk wasn't always this way, was it? Ooh, what's that like to see it change? How much do we long for it to have been the way it was? Because if it was the way it was, then wife would be more like herself, without naming it as dementia, all this stuff. Just gentle spaces of where he's actually experiencing things. Listen, this is such a tough case. I don't think this will solve it, but it may bring him to drop down a little bit into a little more vulnerability. He certainly can't lean on his wife anymore, but maybe he could lean on this beautiful support system that he has here. So that's like one little spot. Can I see you guys try that on? Can you try on an intervention, like a little statement of like some sort of reflection, pushing the envelope a little bit, but very gently without any medical terms of dementia or Parkinson's or anything like that. Even, yeah, go
I
ahead.
mean, my first thing, I didn't have a conversation with him today, but like, why do you think your wife is, like, what do you think is going on? Or like, try to see if he has some type of understanding.
Mm-hmm.
Yeah.
And it seems like he doesn't want to.
Yeah.
Right. So how do we come alongside him without pushing it?
Maybe try to emphasize the fact that she has tried to clean.
Mm-hmm.
Or be like, maybe she's trying.
Mm-hmm. Yeah, and then that should get him more upset, I guess, right? Because it's not working, which really the underlying thing is she's not my wife anymore, or she's not the same anymore. How do we bravely say something like this, like, things are not the same in your home anymore?
I think it'd probably explore the last time he found the home to be suitable. You know, when were things intolerable to you, and what happened? Was it quick? Was it
Right.
gradual? What did it look like? And
Yeah.
at what point did it become
Yeah.
unbearable?
Good. So I love that you're coming alongside him, getting his full experience in terms of what he's reporting. I'm concerned that because his level of awareness is so limited, it's only about the desk and the cleanliness, he's so blocked from admitting this diagnosis. I'm concerned that he's not in the space of awareness of my life is changing, my wife is changing. How do we say a sentence that honors that? And move away from what he's calling out about. So it's like we're attuned, and then we're a little misattuned, but not too far ahead. And I hope I'm being clear and making sense. What kind of brave, on our part, brave statement, because we're going against the system to say this statement. How can we say something like, oh, your wife isn't able to do what she used to do, and that makes you upset? Of course we can go join him, but like what sentence would come? Sorry, I know I keep like feeding what I'm thinking, but I want to hear what you would say using this type of thing of like going a little ahead of him and not focused on the desk. And if I'm bugging you, tell me, I'll back off.
Well, he himself, it's sort of, he hopes and he pins all his, well-being on this, but he's not expecting it.
Right.
And he, it's been like this, and after he was discharged from the hospital, last time he came home, it was exactly the same, it hadn't been touched. He said this goes back to 10 years ago, he sold a house, made a lot of money, and he gave $100,000 of the profit to his wife, and she's a purchaser and a hoarder, and but as he frames it, he recognizes that this is her pathology and that it's very unlikely to change.
Okay, that's good.
And so, I mean, I've been talking with him about, and he's started to dip his toes into the idea of like acceptance or coming to terms.
Yay, good.
But also how impossible that would be. But at least it's like
Even,
on his radar.
even it's on the, right,
Yeah.
it's in the conversation, so that's good. But what you're saying, this is giving me insight. This desk was messy for a
At
long
least
time.
yeah.
Because she's a hoarder. So what we're gonna notice is when the family system changes, these new calls crop up, these new needs that don't necessarily make sense. It didn't bother him before, but something else is going on under there. And so it is very important to join him where he is and then to like drop it down, and you get to guess. You could guess, you could conject, you could guess what that other need is. We have that like permission to do, and try it on, see if it sticks. If it doesn't stick, back away. Oftentimes when I have clients like this where I'm trying to drop them down below their level of awareness, the first 5 times I try it, like, and I don't mean 5 interventions in one session, I mean 5 weeks, let's say. I try something, I'm like, how does that land? They're like, no, that's crazy. I'm like, oh, sorry, silly me. And then I do it again, and I do it again. Still get rejected. I need a self-soothe. It's not fun to be rejected, but that's fine.
When you say again the same guess.
The same guess.
Okay.
The same guess, but like, and still rejected, and may get rejected exactly the same way or different. They don't usually remember that I tried it on them before. They swat it away without like retaining it really. And then I think it planted a seed, and it gives them a little bit more range of motion to discuss. So I encourage you guys to like join your patients where they are and just throw something new out there. If you're seeing something, whatever you guys are talking about over here, bring it to them a little bit in a tiny dose, a micro dose. See if it sticks. Try it a few times. It may do something. Okay, so how are we with our time right now? What time is it? 11:59. Okay, great. And we have a full hour, or?
Yeah, we went to 12:15. Yeah.
Okay, so any questions here with what we've covered, or anything more you want to put into the mix? And am I allowed to say what's this doing to us personally? Because like we're all human beings too. I assume there's some attachment somewhere outside of this room with you. How's this landing? How's it feeling? What are we noticing?
I'm like, ping, this reminds me of this relationship. Ping, this is that relationship.
Which one am I? Don't tell me, I don't want to know. How about you guys? Are you like noticing personal relationships a bit, or noticing yourselves?
We can use me as an example.
Thank you.
Like, I've been going through a lot, as everyone knows, so it's been like, I don't think anyone knew how to handle a lot of the situation. So it was like, a lot of people asking like, how can we help you in this situation? How can we help you in this situation? And everyone has their own feelings about it, like, you know, so I think for myself, I'm seeing like, not even just myself, but everyone around me who's been like, kind of stuck in different places. Yeah.
Yeah, good. What does it do to you when you like zoom out and see them in that stuck place, and where does that leave you, if I may ask?
That's a loaded question.
Yeah. Yeah.
I guess we can specifically think about like my husband, right? Like for him, I think he's had a really hard time even like talking about his own feelings, and then he's not in medicine. So when he sees me having a nosebleed, he like freezes up and has like, he doesn't really know what to do. So I have to be very much like, okay, I need you to do this, I need you to do this, I need you to do this, and it helps. And like over time, he has learned like within the last week and a half, right? But then for himself, like he needs help with it, because then he needs someone to talk to,
Right.
and then he doesn't even know what his need is or how to voice that need. So it's like, I think it's a bunch of people stuck in like a bunch of different
Parts. Exactly,
Yeah.
exactly, right. And how amazing of you that when you're actually the needer, you also are the instructor a little bit, but you're able to instruct because you trust that he's gonna actually do it. So like there's a lot of strength over there. And hopefully soon you won't need to continue calling it out as it's happening, so you could just receive it. And I'm sorry you're going through a difficult time. It's amazing of you showing up, being here for everyone else when you're doing all this. And that's a beautiful sentiment that you have for your husband, that like, hey, wait, I want him to get the support also. He's going through his own stuff too. Yeah. So that's beautiful. Thank you for sharing that. Really, thank you. I know it's very vulnerable to put out there. What does it do when we hear her sharing a bit, breaking this whole lecture structure and just putting a little more of her person stuff out there? What does that do to you when you hear some of her vulnerability? It's real quiet. Yeah, go ahead.
I think, we're colleagues and we work together, and there's also different structures of attendings and residents and whatever. But it sort of opens up another dimension of a person and a human, and we all come to work packing our vulnerabilities away, leaving them in the car or whatever. But there's a continuum, and it can be, in some contexts, it can be very dangerous to be vulnerable, in others it can be very constructive. So I think, at least for me, it's kind of humbling. It's a privilege to hear you sharing more of that, and to know a little more of what your experience is.
I appreciate you putting it out there, and I trust you wouldn't have put that out there if there were like non-safety cues out here. So the system and structure that you guys have created, even if this is the first time, let's say, I don't know if it is, but the first time you share a little more, it really speaks to the fact that there was enough like micro moves of like responsiveness that it felt like it's okay, this is safe here. So that's very good. Thank you. Okay, so we have a few more moments. Let me just hear from all of you. Imagine this goes wrong, and at any point it goes wrong, and then the bond breaks, and then what happens? How easy is it to get back on track if like it really, really, like someone turns off, or someone calls elsewhere, or someone gives up on being here for me because they don't believe they'll soothe me? How easy is it to get back? Difficult. Yeah, easy is not the word. Difficult. So with all the doom and gloom of the difficulty, let me hear, like, why would it be difficult to get back on track?
Because the deficit of unmet needs has now become larger.
Exactly. Exactly. If I'm tracking this, then this is more likely to go wrong than right. So when I'm in the system as the therapist trying to help certain spots get repaired, and let's say I can restructure, guess what they're carrying in with them? They're carrying in that ledger. This is a drop in the bucket, Aviva. I have 7 months or 20 years of it not going well. So when I'm at risk as the therapist to get burnt out. Here I am trying to be the responder and getting them to get soothed. And I kind of have to walk in expecting that I'm going to get blocked. So let me just ask you guys as practitioners, what does that do to you every time you may want to help and you see it gets blocked? Or you want to help, it was a great moment, they even admit it's a great moment, and then they recycle to their negative cycle. What does that do to you inside? Because I know in my raw state, failure, Aviva, you suck. Or if I don't want to feel that, I'm going to put it on them. They suck. Do we ever feel any of this? Or am I the only loser?
You're the only one willing to admit it.
Okay, thank you. That's very kind. You're very kind at work. Wow.
I put all my kind energy there.
Yeah, you guys are lucky.
And then when I come home.
Yeah, it's done. Does anyone know that feeling of I tried and it's not working, or what's wrong with them, or anything like that? Can you relate at all? Does that resonate, or is it something else? So I guess my final question is, how do we support each other in that space? and I bet you guys do. I could feel the vibe here. How do we, like, what's something that a colleague, if we're open to sharing of like, oh, I'm so frustrated, I tried, like, I talked about the daughter coming to clean and even that didn't work, or I'm trying everything, I'm grasping at straws and it's not working. And let's say we're vulnerable enough to share that with each other. What's something that we've heard a colleague here say that was like, okay, it like recentered me and soothed me? Anything?
Maybe you could try to talk to him again later, like you're doing your best.
You're doing your best. Exactly. Good. What does it do when we hear, hey, I'm pretty good in my colleague's eyes? Like my colleague thinks I'm doing my best. That kind of offsets this space of like, I just totally sucked with that patient. Sorry for my language, I'm very, how does that offset? Does that help soothe a little bit of the fail? A little bit. So I guess I just wanna say like the most powerful thing that we have is sitting right here. And you know, you may be sometimes stuck, like we were saying, oh, we don't turn to people because we may be going through something ourselves. So like, we may feel like, oh, I'm not doing a great job today, but just feeling the vibe here, I wanna say you're actually doing an amazing job for someone else over here, like over here. You could get, yeah.
Good question. Right. You know, when we were, Dr. Gazal, we gave an example about the husband. What about if the person has intention to respond? Has an intention to respond, but for certain reason can't really physically respond? Does it mean that it's still broken?
They can respond or they can't.
They want, they're willing to respond.
They're willing
They
to.
have intention to
Yeah.
respond, but for certain reason they can't.
They can't, I see, okay, so good. So I believe in, this may sound crazy, but I believe in resonance of the heart when there's a bond. And I believe that someone can kind of feel like, I feel you wanting to be here with me. So that's level one, even if they don't say anything, even if they don't say, I want to respond. There's like an energy or a facial structure or something that oftentimes is portrayed. But sometimes it's not. Sometimes the person gets caught up in, I want to respond, but I can't. And then they feel like, oh, I'm a failure to my partner or whatever. And then it looks like not only are they not responding, it looks like they're turning away from the caller, they're kind of turning inward. So that's why it's so important to use curiosity, like, hey, what's going on? I thought you would want to respond to me, what's going on? And then that opens up the conversation. The person could say, I really want to be there for you. I wish I had mobility of my legs so I can, you know, walk you here or get this for you or something. I wish I could. I wish I wasn't sick with fever right now. I really want to be there for you. That is good. That is not a broken bond. That is still some level of responsiveness. It doesn't work necessarily if it's the only caregiver we're leaning on. For example, if it were like a baby who like needs to be fed and the caregiver's like, I wish I could feed you, it's not gonna actually give the baby what it needs. So for physical needs, like, no, but it doesn't break the attachment need.
So emotional component is basically important. If
Huge.
emotional component is huge, absolutely.
Huge.
There is intention.
The
Patient
longing.
is willing to respond, but for certain reason he can't actually respond.
Exactly.
You know, he get panic attack with seeing blood or whatever. Still this bond is
Right.
there, it's not broken.
Exactly. The bond is not there. It's broken. And there's a lot, I really trust the resources within the bond. Like as much as then in that moment, the next time there's a nosebleed, you may not lean on your husband as much because you, like even if you're instructing him or not, the actual like attachment is still there. So it's okay. It doesn't, we don't need to lean on our attachment figure 100% of the time for every single need that we have. But yes, as long as there's that emotion, that longing, especially communicative, you know, longing, then that is gorgeously beautiful. Unless it's in the absence of actual responsiveness. There needs to be some level of
Right.
actual responsiveness in other places. Otherwise, after a while, after 20 years, I could imagine like, I don't believe him, or like, that's all talk, or yeah, you sound good, but what does that do for me, or, so it does need, there needs to be some responsiveness elsewhere, yeah. But great question, thank you.
Thank you.
Anyone else before we close down? Okay, so I'm gonna do a little inward noticing. This is all relational. I want each of you to just pay attention to you right here and just notice, what's my need right now? It may be physical, for a cup of water, a restroom, temperature change, who knows? Notice that. And then notice if there's any bubbles of emotional or attachment needs here. And of course, no one needs to share, but I wanted to know that it's being paid attention to, and if it wants to speak to you, it can. And then I'm gonna just say, whatever you do with that, whether you call or you don't call, I trust you have great reason for it. And the more we slow it down and we notice it, even if there are blocks, the noticing is how we respond to ourselves. So I wish you secure bonds within yourself, around yourselves, and I'm extremely inspired to be here. I told David, oh wow, I didn't know that you actually work. I thought you were making it up. So thank you for proving it. I'll report back to the Bam Jam. But I'm also extremely, I feel such a loving, supportive, altruistic vibe when I walk into these corridors, and I just, wish you continued strength to continue healing, and don't worry that we can't fully heal this man with Parkinson's and his wife with, you are doing so much holding their hand along the way, so much. And how can I prove that? Imagine if you weren't here. Imagine if you weren't here. So it may not be, feedback that you see, but you guys are heroes. So just continue your heroic work. Good luck on your journeys back there. I'm so excited for the future of medicine with your fresh face.